Hypoglycemia and panic attacks are two distinct conditions often confused due to some overlapping symptoms, but they stem from very different causes. Hypoglycemia, a condition characterized by abnormally low blood sugar levels, can cause symptoms like shakiness, sweating, and feelings of weakness or confusion. In contrast, panic attacks are sudden episodes of intense fear that may include heart palpitations, chest pain, dizziness, or a feeling of impending doom. Treatment for hypoglycemia involves raising blood sugar to normal levels through dietary adjustments or glucose supplements, while panic attacks are typically addressed with therapy, medication, or a combination of both. Risk factors for hypoglycemia include diabetes and certain medications, whereas panic attacks can be triggered by stress, genetics, or changes in brain function. Here's a detailed look into the nuanced aspects of each condition to clear any confusion. Symptom onset, abrupt versus gradual. Hypoglycemia and panic attacks can present with surprisingly similar symptoms, such as dizziness, sweating, and palpitations, making the differential diagnosis challenging. Hypoglycemia often strikes abruptly, triggered by a rapid drop in blood sugar levels. Symptoms can appear suddenly and escalate swiftly, requiring immediate action to avoid severe consequences. In contrast, panic attacks typically manifest more gradually. The onset of a panic attack may build up over several minutes, with stress or certain triggers leading to a crescendo of anxiety symptoms that peak and then subside. Recognizing the pattern of symptom onset is crucial in distinguishing between these two conditions and guiding appropriate treatment. Primary triggers: metabolic imbalance versus psychological stressors. Hypoglycemia and panic attacks can present similarly with symptoms like sweating, trembling, and palpitations, making it challenging to distinguish between the two without considering their primary triggers. Hypoglycemia, caused by low blood sugar levels, is primarily a metabolic imbalance. It necessitates timely detection through blood glucose testing and is often resolved with glucose administration. Conversely, panic attacks typically originate from psychological stressors rather than a metabolic cause. They can arise spontaneously or in response to anxiety-provoking situations. Cognitive behavioral therapy and medication targeting the central nervous system, such as anxiolytics, are common treatments for panic attacks, highlighting the contrasting approaches based on the underlying triggers. Recognizing these triggers plays a crucial role in addressing the correct condition. Physical manifestations: neuroglycopenic versus autonomic hyperactivity. Hypoglycemia and panic attacks can present with overlapping symptoms, but they stem from different bodily processes. Hypoglycemia, a state of low blood sugar, causes neuroglycopenic effects due to an inadequate glucose supply to the brain, resulting in confusion, weakness, dizziness, and potentially seizures or unconsciousness. On the other hand, a panic attack represents a surge in autonomic activity, yielding palpitations, chest pain, shortness of breath, and a sense of impending doom. Despite similar presentations, the underlying mechanisms are distinct. One is a metabolic imbalance, while the other is an exaggerated stress response. A keen clinical eye is necessary for accurate diagnosis, as treatment for each condition is notably different. Common populations: diabetics versus anxiety-prone individuals. Hypoglycemia and panic attacks share similar physical symptoms: trembling, sweating, and a sense of dread, making them easily confused. In diabetics, hypoglycemia results from an imbalance in blood sugar levels, typically due to medication, skipped meals, or excessive exercise. Immediate consumption of sugar can reverse the symptoms. Conversely, anxiety-prone individuals may experience panic attacks, which are acute bursts of intense fear, often accompanied by a racing heart, shortness of breath, and a feeling of loss of control. While the two conditions share commonalities, their treatments diverge. Hypoglycemia's physical intervention contrasts with the psychological and sometimes pharmaceutical strategies employed for panic attacks. Distinguishing between them is crucial, as administering sugar to a person having a panic attack may be of no benefit, and psychological techniques are ineffective for low blood sugar. Treatment response: glucose administration versus relaxation techniques. Hypoglycemia, a condition characterized by an abnormally low blood glucose level, can cause symptoms such as shakiness, sweating, and palpitations that mimic a panic attack. However, treatment responses for these two conditions markedly differ. Administering glucose can rapidly reverse hypoglycemic symptoms by normalizing blood sugar levels. If symptoms quickly alleviate after glucose intake, hypoglycemia is likely the cause. In contrast, panic attacks are psychological events best managed through relaxation techniques such as deep breathing, mindfulness, or medication. No significant improvement is typically seen after glucose administration in the case of a panic attack, thus aiding in the differential diagnosis between the two conditions.